All right, here we go. There we go.
There we go, folks.
Welcome to SPAN. My name is Mark Davis, and I'm honored to be this year's president of SPAN. I also work in the trust department at D.A. Davidson Trust Company and co-founded SPAN in 2007 with Joe Ottinger, Alan Pratt, and Paul Shoemaker. We are grateful to have a panel of experts in the field of philanthropy, focusing today on philanthropic impact of COVID-19 and also social justice and race-related issues. Next, I will thank our sponsors, and then we will begin our panel discussion. The gold sponsors are D.A. Davidson Trust Company, Deloitte, Fulcrum Capital, Helsel Fetterman, Morgan Stanley, U.S. Bank Wealth Management, and Whittier Trust. Our silver sponsors this year are Bader Martin CPAs, Clark Nuber, Columbia Bank, Del Prado Philanthropy, Ernst & Young, Filament Advisors, Goldman Sachs, 180 Foundation, and Seattle Children's Hospital. Before introducing Lorraine, throughout the presentation, please send in any question you may have through the chat functionality on Zoom. We will then have time at the end of today's presentations to answer questions, and we appreciate any questions you might have. Lorraine del Prado has been instrumental to the success of SPAN as a founding and current board member since 2007. Her company provides training and consultation services to individuals, nonprofits, and wealth advisors. She is the immediate past president of the Washington Women's Foundation, and really want to thank Lorraine for leading off our panel discussion today. Thank you, Lorraine.
Need to make a correction. I am not the immediate past president of the Washington Women's Foundation. Far from it. I chaired the grant committee this year. So, so thank you so much, everyone, for joining us today. My role is basically to set the context of this conversation. So I will be talking about COVID-19's impact on nonprofit operations and revenue sources. I'll be talking about the populations that are disproportionately affected by its adverse health and economic consequences. And I'll also be sharing certain trends that I'm seeing as nonprofits adapt to to an uncertain future and to this heightened need to pursue social and racial justice now. So needless to say, nonprofits almost universally have been really devastated by this pandemic. Many have already been operating to their limits with very little or no surplus. Less than 25% of all nonprofits have 6 months of cash in reserve. Most have only 2 to 3 months of cash on hand. So the pandemic's impact on their fundraising has just been devastating. Many have funding levels that have not recovered from the 2008 recession. They have canceled their fundraising events that contribute a significant portion of their budget. And because of social distancing, many could not provide services that are a source of fees and earned income. On average, those fees and earned income actually represent about 45% of all nonprofit revenue. And the demands for their services are increasing due to COVID-19's economic and health consequences. While they are all forced to reduce their programs, reduce staff, reduce hours, reduce wages and benefits. I thought in understanding the impact of COVID-19 on nonprofit operations that it would be useful for me to adapt the classification proposed by this financial consulting company, Sea Change. According to Sea Change, nonprofits are either responders, hibernators, or hybrids in their response to COVID-19. So responders are those nonprofits where the demand for their programs and services have actually surged while COVID-19 is disrupting their normal operations. And then you have the hibernators, who for the most part are unable to operate during the crisis. And then you have the hybrids, where they can offer their programs, perhaps online to some degree, despite the COVID-19 crisis. So let's take a look at some examples of these classifications. So for responders, definitely health and human services organizations belong to this classification. So our hospitals and health clinics have just been affected tremendously by this pandemic. They're overwhelmed with higher hospitalization rates. And of course, the intensive care unit has been used to the max with these cases. They have higher outlays in terms of expenses for personal protective equipment, and yet they have less revenue because of the interrupted elective admissions. On average, hospitals around the country only have less than a 5% surplus. And elective procedures, the revenue that they gain from those procedures, on average contribute 30% of all hospital revenue. So interrupting those procedures has just been really devastating to hospitals. The American Hospital Association estimates that losses to America's hospitals in just the 4 months of March through June, it's about $202 billion, or $50.7 billion a month. And locally, we see this with UW Medicine, which had to furlough 4,000 of its unionized staff and 1,500 of its professional staff in order to address that $500 million shortfall that was caused by COVID-19. Another organization or type of organization that would be considered responders would be your food pantries. Right now, there are 1.6 million individuals in Washington that are considered food insecure. But because of rising unemployment and poverty, Northwest Harvest is projecting that 2.2 million individuals in Washington may be food insecure during the peak of the COVID-19 crisis. And that's 31% of the state's population. So moving on now to hibernators, those organizations that for the most part are unable to operate during the crisis. Foremost, I think, of these would be arts organizations, especially the performing arts organizations that are hardest hit, as they depend on ticket sales, and they can't actually sell tickets, they can't perform, and even when they get grants, those grants are contingent upon their ability to perform to an audience. According to Arts Fund, 5,000 arts and culture personnel are currently out of work, and there's about $135 million in projected loss of revenue. 97% of these performing arts programs have been canceled. For example, the Seattle Opera canceled its spring programs, La Boheme, and summer program, Pagliacci and Cavalleria Rusticana, and actually furloughed 58% of its administrative staff. And the rest of the staff that are remaining actually have to undergo pay reductions. Performing arts organizations that maintain space also need to renegotiate rents, to stem the further hemorrhaging in their finances. And of course, we know that museums have also been closed until phase 3. So, many donors may want to prioritize giving to responder organizations at this time that are providing for basic needs of those who are most vulnerable. And that is really understandable, and that should be their priority. But let's not abandon the arts, for the long term. We can't imagine what our community would be like without these arts and culture organizations providing us upliftment and healing and insight into the human condition. And especially now too, they've just been very instrumental in communicating insights regarding the racial and social injustices that our brothers and sisters are experiencing in the community. Next, let's get into the hybrid organizations that offer programs that can be provided to some degree despite the COVID-19 crisis. So these are educational organizations, training and counseling and support programs that perhaps can be delivered online. But this is hampered by the digital divide. So low-income families are not able to totally maximize these services because they don't have access to computers. They have unreliable internet. They have inadequate devices, and they don't have digital literacy skills. Distance learning also cannot provide other key components of in-person school experience, such as socialization, a variety of school supplies, and most importantly, school lunch. A good example of this is a nonprofit organization, Denise Louis Educational Center, that provides early learning and family support services for multicultural families, most of whom are low income. So Denise Louis pivoted very quickly so that they could provide remote learning for a lot of these very, very young children, and they're providing resource kits for families so they can help guide the activities of their children. But they're also providing food delivery and pickup for its kids, so to ensure that they have access to nutritious food. There are all these populations that we are keenly aware of now that have been disproportionately affected by COVID-19, and that should really be prioritized by nonprofits and philanthropists. It is a national tragedy and is a real source of shame in our country that communities of color have poorer health outcomes due to gaps in insurance coverage and even access to services, and a variety of stressors that lead to chronic disease. And of course, underlying all of this also is systemic racism. And this has been magnified by COVID-19. African Americans in particular have truly suffered. In King County, African Americans make up 6.4% of the population, but they represent 10.2% of all cases. Nationally, African American deaths from COVID are nearly 2 times what would be expected based on their share of the population. And for disproportionately Black counties in the US, which account for only 30% of the US population, but they're the location of 56% of COVID-19 deaths. So Blacks suffer from structural racism. They have higher rates of underlying health conditions like diabetes, hypertension, and heart disease that make them a lot more vulnerable to COVID-19. They have less access to healthcare, and they disproportionately represent their workers in essential frontline jobs, those doing deliveries, nursing assistants, home health aides. And they suffer from higher unemployment rates. So right now it's 16.8% for Blacks versus 13.3% for whites. And for every $1 that a white person earns, a Black person earns 62 cents. And they've also struggled to build wealth. According to the Center for American Progress, the median family wealth for Blacks is $17,200 compared to $171,000 among whites. So you can just imagine how they don't have really anything extra if their employment is hampered during this crisis. The Latinx community has also been disproportionately affected by COVID-19. In King County, they make up 10% of the population, but they represent 23% of all the cases. The Latinx individuals are overrepresented in essential jobs, so that increases their exposure to the virus. They have higher rates of poverty and low wages. They also live in dense housing conditions that make them very vulnerable to this pandemic. And a subset of the Latinx community is made up of these, what they call unauthorized immigrants, who are shut out of relief. So they do not have access to the PPP loans. They do not have access to unemployment insurance, and they're subject to wage abuse. Casa Latina, which is one organization that provides a lot of services for these immigrants, providing them with employment, with language skills, with advocacy, has actually really needed to pivot to help with the basic needs of these individuals, providing them with food, providing them with cash so they can just survive in the coming weeks. Another community that has suffered disproportionately are your Native Americans. The Navajo Nation has been written about recently. are in Arizona and Utah and New Mexico, and they have a 3.4% infection rate. So there are 6,000 confirmed cases now out of a population of 175,000. And they suffer from underlying health issues that make them vulnerable to the disease, but also lack infrastructure such as electricity and running water. So one other thing that nonprofit organizations need to contend with, and they still don't know how this is going to appear in the future, would be the long-term consequences of COVID-19. It appears likely that there will be substantial increases in anxiety and depression, substance abuse, loneliness, and domestic violence. And there might also be an epidemic of child abuse while the schools are closed. And this is according to the Journal of American Medical Association. Students may also regress in their learning due to the school closures and the lack of intellectually nourishing activities, and children missing regular reinforcement from their peers, from their teachers, which is usually what they would get from school. The opportunity gap between white and Black students will most likely also widen as a result of the school interruption and the digital divide. This opportunity gap now translates to about 2 years in school learning. And then there's the interruption of mental health care. Apparently, 13% of adolescents receive mental health care from their schools. And for 35% of these, the schools are the only source of support for their problems. Then the isolation and physical distancing also may adversely impact the development of socio-emotional skills of our children, like regulating feelings, exercising self-control, managing conflicts with peers. And people with non-COVID health issues are avoiding hospital visits right now. I'm hearing from my doctors that they're not seeing the same number of people who might be suffering from hypertension or all kinds of other diseases, which may get exacerbated later on because they're not seeing their physicians and other healthcare workers. And then there's also the post-traumatic stress disorder of our frontline COVID-19 responders. We read about this tragic suicide of the top emergency room doctor at New York Presbyterian Hospital. Did not seem to suffer from depression before COVID-19, but just the repeated trauma of seeing all these deaths may have led this person to that tragic end. So, so we don't know how these would be manifested in the future among our frontline caregivers. And past research has also shown that African American, Native Hawaiian, Hispanic, and Asian individuals apparently have higher rates of post-traumatic stress disorder than whites. Thankfully, there has been some relief, not by any means adequate, but something that we're grateful for from the government, from individuals, from businesses. As everyone knows, the CARES Act with its Paycheck Protection Program and small business loans were also there for the nonprofit organizations. The nonprofit leaders did express some frustration over the process and needed to change some of their banking relationships in order to access these loans. The Seattle Foundation had a COVID-19 response fund that they raised more than $21 million from a coalition of philanthropists, government, and business partners, and distributed close to 11 million in round one and to about 120 organizations, and deployed it very, very quickly to these organizations. King County also has a COVID-19 community response fund with 800,000. Arts Fund also had an emergency relief fund of about 2.6 million that they distributed to about 80 King County cultural nonprofits in round one. And there are all kinds of other COVID-19 rapid response funds for the humanities, the Latinx community, for undocumented individuals, and for all regions in Washington. So I mentioned earlier that COVID-19 has had a devastating impact on the revenue generating activities of nonprofit organizations. CCS is a fundraising consulting firm that conducted a survey in early May, and it involved 1,183 nonprofits nationally. And 63% of those nonprofits cited a decline in their fundraising since the start of the pandemic. And 80% expect that there will be a decline in fundraising results for the remainder of the year. The Center for Effective Philanthropy just released its survey. There were less organizations, less than 200, but it still provided some insights into how the nonprofits are coping with COVID-19. 43% of them said that they've seen a decline in major gift support. And they define major gift support in this survey as gifts of $7,500 or more. And 51% saw a decrease in non-major gift support, so lower level contributions. Among my clients, there's been a cancellation of fundraising events for the rest of the year. All have either postponed the launch of capital, endowment, and comprehensive campaigns, or are conducting conversations with just a handful of major supporters who are key to the success of their campaigns. But there's a positive a development in fundraising from foundations. And I think the Ford Foundation has been really sounding the drumbeat on how grant makers should respond in a crisis like this. So 39% of the grantees have said that the level of funding has stayed the same, while 31% have said that the level of funding has actually increased. So that's wonderful. And a lot of these grant makers have also allowed their current grants to shift from being restricted in purpose to being unrestricted. They've extended or waived deadlines for the completion of work. And they've just actually reached out also to their grantees, asking them how they're doing, how can they be of help. So a real partnership is emerging. There was this wonderful story of World Relief Seattle that was published in the Chronicle of Philanthropy, and they talked about one of our SPAN featured philanthropists, Chris and Heidi Stolte of the Stolte Foundation, who had already given the World Relief Seattle a grant prior to the pandemic, but reached out and asked them how they were doing and decided to actually give an additional grant. So that's wonderful. But nonprofit organizations are still very much uncertain about what's going to happen in the future, especially with government grants and contracts. And this uncertainty is making it very, very difficult for them to plan. What do they need? They need definitely more funding. They need more unrestricted funding, and they also need more transparency. So they would really appreciate it if donors would reach out to them and let them know how the pandemic will impact their future support. And this will help them plan for the future. So for a number of you who know me, you know that I'm an eternal optimist. So I always look for a silver lining in all of this. And there are a number of things that I've seen as positive results of this pandemic. Number one is really this increased focus on activities that advance the mission of organizations. So they're not going to look at other opportunities. They're really just focusing on their mission and activities that advance that mission. And most importantly, using a social justice, if not a racial justice lens, in prioritizing services to the most vulnerable. I was mentioning to my colleagues earlier today that I would not wish COVID-19 to any executive director of any nonprofit organization, because the kind of pivoting that they've been doing recently has just been endless, and it's every day. But what this has also brought them to is really refining their decision making, coming up with principles that would guide their prioritization of resources, and really coming up with knowing what is non-negotiable, what should they never compromise on. They also need to come up with financial guardrails now. So given how limited their resources are, so what financial guardrails should they pay attention to so that they can somehow balance the need for them to continue serving a vulnerable population while also somehow assuring that they're still resilient and they would still be sustainable. The COVID-19 situation has also flexed their creativity, their innovation, their adaptability, their problem-solving skills. So I think we are seeing the grooming of the next generation of leaders who have been battle trained and who would be really fantastic leaders of our social programs in the future. Where fundraising is concerned, I've also seen a really nice shift from transactional fundraising to a kind of fundraising that is more focused on building strong and enduring relationships. I see my clients actually calling their donors, asking them how they are, and really having wonderful conversations about their lives, about how they're viewing what's happening right now with the protests and the social justice movement. So that those are wonderful conversations that they're engaged in right now. And I like the fact too that there's less of a reliance on these flashy fundraising events that are expensive, that involve donors that are less connected to the mission of these organizations. So really only probably about 30 to 40% of the participants of these fundraising events that are truly connected to the organization, while the rest are friends of friends. And these events actually take on too much time and are so expensive, and they're actually opportunity costs because they're sacrificing opportunities for these fundraisers to be in one-on-one relationships with these donors. And there's also been an increased interest in planned giving, which is wonderful because individuals right now may not have the discretionary income to make large gifts, but they can still include charities in their estate plans and make magnificent legacies. And so there are a lot of organizations that want to really resuscitate, reactivate, or bring their planned giving outreach programs to the next level. So I hope that overview is helpful in giving you some sense of what nonprofits are undergoing right now, how they've been adapting, and what their needs are. So now I'd like to hand the discussion over to Sarah Hopper to talk about how philanthropists can lean in, given really the severity of the situation. Sarah is the founder and principal advisor of Sound Philanthropy, LLC, and she's a recognized expert in philanthropic consulting. She guides families in their meaningful philanthropic journeys and is involved with multiple generations of those families. And she previously held a leadership position of Vice President of Philanthropic Services at the Seattle Foundation. Take it away, Sarah.
Thanks, Lorraine. Thank you for your insight and amazing ability to provide so much valuable information. And good morning, everyone. I just want to start by acknowledging that when we scheduled this event, the focus was on COVID giving and trying to bring some resources and ideas to all of you in your work as advisors. With clients and about effective ways, impactful ways to think about giving and stretching your giving during COVID. And since then, the escalation of this crisis is profound, and we are now sitting not only with a global pandemic and economic crisis, but also with an enormous, meaningful strong movement towards bringing about racial justice, ending anti-Black racism. And, if we were to hold this panel next week, who knows what where we would be. Things are changing. Lorraine alluded to that as well, and things are really evolving at a rapid pace. So I want to take time today to talk about what I'm seeing, especially with some of my clients in terms of their recalibration of their giving toward emergency response funding in response to the COVID pandemic, but also the questions that I'm getting and ideas around how to really be part of this anti-Black racism movement from a philanthropic perspective. And, Lorraine said this really beautifully, that the important thing to know is that the populations that are disproportionately affected by COVID are people of color, and especially Black people, and Black communities. And she talked about the underlying health and economic and social issues that contribute to this disproportionate impact. But the big, hairy, impossible to ignore underlying issue is the centuries of racism and oppression and injustice against Black people. And so they're intrinsically connected, and I just think it's important to recognize that as we sit here. So let me start by talking a little bit about COVID and the philanthropic response that I saw, especially through my work with clients, foundations, and individual donors to support the efforts to help people affected by COVID. And giving in response to a pandemic makes sense. Sort of in your mind as you think about philanthropy, it kind of makes sense. It's disaster relief funding. People are hungry. People don't have homes, have lost their homes, are unstably housed, can't pay their rent, have lost their jobs. So you give to programs who are helping to meet the basic needs of those who are affected. And it's a type of giving that just is easy to sort of grapple with and get your head wrapped around. I was on a call last week. Here's some, I'll try to sort of powder my presentation with hopeful things as well, because I feel like there's so much that just feels not hopeful right now. But I was on a call last week where there was a presentation from the Center for Disaster Philanthropy, and as of May 20th, there has been $10.7 billion in emergency response giving in response to the COVID pandemic. So that's fantastic. That's a lot of generosity and funding towards those in need. It's not over, but I just think that's something to celebrate. So, my clients responded quickly. They responded with unrestricted, flexible, no strings or low strings attached funding for grantees. And they loosened restrictions or obviously flexible funding, but they also loosened their requirements for reporting. So, really allowing their grantees to use funding, and many of them stretched their funding, but using it towards their greatest needs. And that was when you hear, and Lorraine also alluded to this, what nonprofits were asking for, what the leadership in our nonprofit community was asking for. It was just that, unrestricted funding, general operating, greatest need funding. I wanted to sort of highlight a couple of, anonymously, but a couple of clients and how they, what they did with their, in terms of their recalibration and their pivot. One of the foundations I worked with was sort of in the middle to the end of a regular funding cycle, in their sort of strategic programmatic grant making, and the decision was made to continue with that cycle, to make those grants. Those organizations had applied through their normal process and were anticipating, hopeful for funding. So that cycle concluded, and then the board decided to really take the remainder of the budget, of the grant making budget, so around 2/3 of their grant making budget for the remainder of the year, and apply that all towards emergency grant making, emergency response grant making related to COVID. And most of those grants had to do with food, housing, homeless youth shelter, homeless students, homeless youth, and they, one of the things they did that was so smart was to give. They've done now 2 rounds of grant making with this budget that they have for it, and they've also reserved a portion for to allocate in the fall or later this year, which is something that as I've advised clients and other philanthropists. That's important. It's important to give now, give quickly, stretch your giving, but also this is not going to be over anytime soon. So reserving a portion for the future, whether that's the summer, the fall, early 2021, whatever that looks like. If there's a way to sort of divvy up your grant making budget in that way, knowing that there will be recovery and rebuilding and even likely more emergency need, ongoing emergency needs throughout the fall. Another client, we had taken a lot of time and effort to really create a programmatic strategy that aligned the grant making that this foundation does with the mission of the foundation as in a tighter way, in a more strategic way, in a longer term way, and bringing the long-term grantees of the foundation to sort of aligning them with each other and finding ways to invite their participation in our own impact-driven strategy. It was sort of the next phase of grant making for this foundation. And I think we sent out the communications to the grantees in early mid-March, I think it was. And needless to say, we sort of turned around and emailed them all and said, putting this on hold. We don't have expectations of how you're gonna sort of align and provide input and partner in this way, because we know that you are, as Lorraine reiterated over and over, really scrambling to just get your programs, ensure that the people, the populations that you are serving are surviving. In this case, a lot of the grant making goes towards vulnerable youth populations, especially those who are homeless or unstably housed. And so we made grants to all of those grantees that were unrestricted, again, greatest need grants, and with the communication that there will be another round in the fall, but possibly including those grantees, but also broadly funding the emergency needs and the recovery needs in the wake of COVID. So, and this grant maker decided also to allocate 100% of their budget towards emergency response this year. So there's no strategic grant making in 2020. Another interesting story that I wanted to mention, because this is one that has that's a little different and has brought me a lot of hope as well. I was working with a client on doing sort of a very deeper level of due diligence and conversations with NPR. And this client had an interest in funding efforts that NPR was making, efforts that NPR had sort of spearheaded around news deserts, and ensuring that that the quality programming, quality reporting, news was getting into places that didn't have the capacity or lower capacity, less access to NPR type reporting. And so they actually have an incredible program that it's not widely publicized. I've learned so much about NPR and public radio, but they don't do a lot of fundraising directly, sort of through website or through direct outreach for some of their initiatives, because out of respect for member stations and how that whole sort of relationship works. And so I had to dig to find this, and then sort of dig to find the right person to talk to about it. But the short story is that this client has fully committed in an even larger way to a multi-year, multi-million-dollar commitment to the Collaborative Journalism Network, which is essentially creating hubs in places like the Gulf Coast, in places like the Midwest, where there is lower capacity for public radio, and building that capacity and sharing resources and reporting, and not only bringing local news to those parts, but also bringing that local news to a national and international level in order to uplift these regions from the perspective of the news that's being reported. And it's just so exciting. It just truly is inspiring. So, so this was a client who's doing grant making in terms of emergency response, but what they saw was this need for, at this time, for quality public radio reporting. So that's been really exciting to be part of. And the last thing I'll mention, kind of from what I'm seeing from the philanthropist side in terms of the COVID funding, is there's two of my clients where I work with the next generation members. So Lorraine mentioned that's part of the work that I do. And so with these foundations, I'm working both with kind of the governing generation, who are board members of the foundations, and then also sort of autonomous programs with the next gen. And it happens to be a time where I'm leading, I'm guiding, they're the leaders, I'm guiding them in the programs for both of them. They sort of launch in the spring and carry through the summer, and both of those groups, these are young people, and mostly in their 20s and early 30s, have responded with enthusiasm, with a learning stance, with a commitment to not only COVID response, pivoting sort of from climate change, which is where they were planning to focus, to emergency response. Not that climate change isn't vitally important right now too, but they decided to make that pivot, as well as integrating the movements around racial justice and anti-Black racism and what's happening there, and just being very authentic and proactive about it. And so there's that brings me a lot of hope too. And just the change is going to happen with that it has to happen with everyone, but it's especially going to happen with that generation. And I get to see it in my own client work, which is pretty remarkable. My advice to clients as this all sort of came to a head and my advice it continues to be what I tell people and clients and others who reach out to me is, give first and foremost to the organizations that you care about. Lorraine did a wonderful job of kind of talking about the responders and the hibernators and the hybrids and all of the broad impact on the nonprofit sector. So if you don't know what else to do, go back to those organizations that you have a relationship with, that you care about, and give there. And I'll just reiterate, sort of the other advice that I was handing out was around flexible and unrestricted. Give flexible funding for the greatest needs and let the organizations decide what that is for themselves. Lean into existing expertise. We can't all be experts. And in fact, most of us are not in what's going on. So rely on the Seattle Foundation Fund for, to know exactly how to deploy quickly, how to deploy those grants to the communities that need it most. They have those relationships. That's a great fund. It's still working. It's still going. Rely on the expertise of Building Changes and the Raikes Foundation, who's launched a fund for homeless students across the state that has made their first round of grants and has tremendous impact in what's happening with young people and their families and students who are homeless students who are again disproportionately impacted. So find those who have expertise in the areas that you care about and provide collective funding, partner with them, and support what they know and what they're doing because they know. And then again, I'll just, like I said earlier, just be sure to reserve some funding for later because again, it's not going anywhere anytime soon. So I want to talk just a little bit before I introduce the next panelist about because I'm getting a lot more questions, and I also feel very strongly personally about what's happening with protests and with the racial justice and the anti-Black racism movement that's happening right now and is so important. This finding ways to be philanthropic to support efforts of this movement and what's happening with this movement it's more complex. It's not emergency response, and it's longer term in a different way. I think what's required now is change on 3 different levels, and there's the personal level, the internalization and the examination of our own personal bias. There's the operational level, and for philanthropists, for foundations, that means analysis of grant-making practices and our learning approach and who's at the table and how we're structuring that process. And this all leads to the 3rd level of change, which is the longer term, but needs to be happening, is the systemic change that we are collectively, with guidance and leadership from our communities of color and especially from the Black community, rethinking and redesigning the institutions and the systems that have perpetuated the racism and oppression. So it's bigger, it's more complex, it's complicated, it's nuanced, but it's vitally important, and we must propel this movement forward until this change happens. This can't go away. And as donors, as philanthropists, I think what that means in terms of how we deploy funding, I don't have all the answers. I bring my own expertise into it, but I also encourage you, as I am doing, to rely on Black communities and Black leaders and the movements who have better answers than I do. I think what can you do now? You can give to organizations that have Black leadership or person of color leadership. Give them flexible, unrestricted funding. The same sort of, you're hearing that over and over from me, but it applies in this case as well. And don't just do it this year. Do it next year. Do it for the next 5 years. Keep doing that. I was listening to a podcast the other day on this topic, and the speakers, there was a conversation, and one of the speakers said, power in numbers. If we all gave donations to Black-led organizations and we did it this year and over the next 5 years, what could happen? Imagine what could happen. So that power in numbers really, really resonated with me. Giving to Black Lives Matter and giving to other funding opportunities that are propelling this movement, that are moving this movement forward. Borealis, Borealis, Philanthropy is a great resource for finding effective giving opportunities to support this movement. And as well as just giving directly to Black Lives Matter is something to think about. And finally, I will say, think about advocacy. And I say advocacy, when we think about advocacy, we think of systems change. And obviously, from my earlier point, that is vitally important right now. But advocacy is also peer influence. And I think that we all have a responsibility not only to be listening and learning and paying attention and ensuring that this movement does not die out, but we also need to hold each other accountable and inspire and excite and ignite others to join in this. So advocacy in terms of systemic change, and also in terms of peer influence as well. So with that, I'm going to pass the baton to Stephanie Gillis, and we're so lucky to have her on the panel today. Stephanie is with the Raikes Foundation and leads their impact-driven philanthropy initiative, Giving Compass. And if you're not already signed up for Giving Compass, as soon as you get off this fantastic panel, I urge you to go and sign up. It has tremendous resources for donors and advisors around ways to have impact, especially equitable and just with sort of the equity and justice lens in your giving, and the learning opportunities, as I said, and the resources are just are fantastic. And Stephanie's really led this initiative since the beginning. So I will turn it over to you, Stephanie.
Thank you so much. And I'm just really happy to be here with everyone and have so much respect. You stole my closing lines, Sarah. So thank you also for plug for Giving Compass. I'm really delighted to be here today. And at the same time, I think as many of us noticed, we had some mixed feelings. And I certainly, partly because the world around us keeps changing so quickly, and partly because we're missing today the voices of those that are leading community-based organizations and leaders of color who really have the best perspectives on these intersecting challenges that are facing our country right now. And certainly it's been over 20 years since I was in a community-based organization myself, facing the challenges that Lorraine alluded to earlier, trying to figure out how to raise the dollars to support youth-led organizing. But I was encouraged to participate today by many of my colleagues who do hold those perspectives. And many are observing today the general strike that Black Lives Matter Seattle called to support silent marches, as our foundation team is. So I know how inspired you would have been by those voices. And as Mark and all of us have talked about, we hope this might be an opening to what might become another conversation in the near future. As Sarah said, I work for Jeff and Tricia Raikes at the Raikes Foundation, where our vision is a world where race is no longer a primary predictor of life's outcomes for young people. I lead an effort at the foundation focused on influencing individual donors to give in ways that are more likely to make a difference. And many of us know individual giving is actually 80% of the $400 billion that are directed each year through philanthropy. It's not the big foundations. And yet what we confirmed in our early research is that there just weren't enough quality and accessible resources to support donors. And when donors came across them, they didn't know what they could trust and what really was good. And ways to connect donors to what the field knows about what works. So our goal is really to encourage more donors to practice what we have called impact-driven philanthropy. And we really believe that to get to impact, it's essential that donors understand the historical and racial context of the issues they're interested in, focus on effectiveness and where the evidence is, and also address root causes to change systems. And I'm just going to reflect for a moment. There's something that's really struck me about this COVID-19 pandemic mean, on the one hand, we're all masked. Whoever would have thought a year ago that we'd be wearing these masks everywhere we go? But on the other hand, as a friend of mine noted yesterday, the pandemic also has really unmasked the underlying conditions of structural racism that others have already spoken about, and opened the eyes of so many of us to the challenges facing people of color in this country. You know, as both of the previous panels noted, the disparate outcomes for Black and Native American and Latinx populations are not accidental. They're the results of years and years of systematic and cyclical oppression. And policies and systems that have been influenced by racism. And now these ongoing racial justice demonstrations and conversations that are happening all over the country are leading so many people to really try to understand how we've gotten here. And this is where I'm really taking hope. If any of you have had a chance to look at the New York Times best-selling nonfiction book list this week, it's just incredible. I mean, number one is our local leader, Ijeoma Oluo, and her book, So You Want to Talk About Race. Second is White Fragility from Robin DiAngelo. But it's not just a few. I mean, almost the entire list is focused on race. Trevor Noah's Born a Crime, and Ibram Kendi's amazing Stamped from the Beginning, and the incredible Brian Stevenson's Just Mercy. If you haven't seen that film, so encourage you to watch it. It's free on Netflix this month. But it really gives me hope that many more of us are ready to talk about race and racism in our country, and to notice and realize that racial justice isn't a vertical issue that can be addressed in isolation, but rather as a horizontal and a factor in every issue philanthropy seeks to address, whether it's climate change or housing and homelessness or food and hunger or poverty or the arts or education or COVID. And the fact of the matter is that the people in our country who've accumulated wealth are overwhelmingly white. And because of housing and education and other policies been influenced by these factors, unless we make considerable effort, we're rarely in proximity with people who are not like us and are experiencing these challenges. And it becomes much harder then to give money away in ways that are going to really be effective and truly make a difference. So we launched Giving Compass in part to help donors learn about the issues, and from those who do have deep knowledge, and also not just about issues, but how to give, the best practices and how to give. And we also recognize that it's a lot of work to learn and get steeped in what is, a field for people like us who work 24/7 and do nothing but digest this information and process it. Most donors are giving in their spare time on weekends and running businesses and families and all kinds of other things. So we understand that. And part of our theory was that for donors who don't have the time to lean into learning deeply, there are intermediaries and issue funds, as Sarah was speaking about, people who are more proximate and closer to the ground that can allow donors to piggyback on their expertise and strategy and support an array of organizations that are working on any given issue. So we had begun aggregating on Giving Compass a data set of these issue funds well before COVID. But in the wake of the pandemic, we saw more and more that were emerging, mostly relief funds that are COVID specific. As Sarah and Lorraine both mentioned, Seattle Foundation was a national leader in this moment, launching its fund, which is exemplary in many ways. It's a public-private partnership. United Way and Seattle Foundation came together in alignment and is really committed to reaching those who are most vulnerable in this region. We now have a data set of over 500 COVID-related funds on Giving Compass around the country and around the world. And though the devastation and impact of COVID is unprecedented, there are still lessons to be drawn from philanthropic responses to other disasters. I mean, fundamentally, we think of 3 stages for philanthropy's response to COVID. And the first is relief, as Sarah mentioned, giving to the food banks and the efforts to secure PPE and rent relief, other efforts to alleviate the immediate pain. Most, roughly 80% of the funds in our data set now are focused on these relief efforts, which is where we are in the philanthropic response at the moment. But the next phase is rebound and turning the ship, really supporting efforts to develop a vaccine, expand testing, things like ensuring all students have access to Wi-Fi and technology to support online learning. There's a small proportion, roughly 13% of the funds we found are focused in this rebound phase. But then there's this huge opportunity to reimagine and restructure. And that phase has actually been accelerated by the murders of George Floyd and Breonna Taylor and Ahmaud Arbery and others, which sparked this movement for Black lives. The combination of COVID-19 and this racial justice movement has led to more structural changes in weeks than anyone ever could have imagined. We're seeing criminal justice policies and policing change all over the place. School policies, city and other budgets are being reshaped. And COVID has shown us also that people can be productive from home, schools can use technology to teach, artists can perform for wider audiences online. Only about 5% of the funds in our data set right now center on this reimagining and restructuring. And we're really hopeful that there can be more of that. But what I will say is the ones that are there are pretty amazing. We really think hard about what to put on our platform and have spent a fair amount of time vetting. And about a third of the funds that we have touch on the three criteria I mentioned earlier of impact-driven philanthropy. Not all funds are created equally. So, when we looked at the data set and we're thinking about equity and effectiveness and systems change, the 5% focused on reimagining and restructuring would touch the systems change, may not touch all three. So we looked at them also with that lens, and there's a little over a third of them touch on those tenets, and only about 13% mention race or focus on the most vulnerable communities when we look really closely at their public materials. So it's important there are many ways to filter. We've provided quick filters to allow you to look at those that are in these three phases, or to find those that are tagged with our IDP tag. My father, who recently passed away, was in medicine, and we know that we can continue to treat the seeping wounds of this disease and the disease of racism or other virus. We can stitch and we can put Band-Aids on, but like in medicine, we know that to be effective and really reduce the human costs, we have to work more upstream. We have to get to prevention, and we have such huge opportunities right now in our country to reimagine our communities and the future, and to build a future where all people can truly access opportunity and realize success across lines of race and place and gender and class and sexual orientation. We have to listen closely now to those who are currently least well served. We have to focus on including their voices and lifting up their power in decision making as we evolve forward. We can put more dollars into the hands of the people who reflect the communities we most want to help. There was recent research, there's a plethora of research showing how underfunded leaders of color are, whether they're social entrepreneurs or business leaders and entrepreneurs in businesses. We all saw the data around who did and didn't get the PPP loans, and Echoing Green and Bridgespan, which is a social consulting firm launched by Bain, found that not only do we give to fewer organizations led by people of color, but when we give to them, we give less money. And that's after we account for things like the issue areas they work in and their education levels. So we really have this tremendous opportunity. There are some amazing and exciting efforts that are emerging now. Our team was on the phone yesterday with the leaders of the Visionary Freedom Fund, being launched by the Andrews Family Fund, which will support youth organizers working on youth justice issues nationwide. The Headwaters Fund in Minneapolis, where these protests started, launched the Transformation Fund. The Emergent Fund, which is was launched together by Women Donors Network and Solidaire and others, has an amazing panel of social justice leaders that have decision-making authority and allocate the resources. Closer to home, Social Justice Fund Northwest has an incredible fund to support local organizers through the COVID challenges. And there are many others. We encourage you and your clients to explore. I can chat some links. But when you're looking at funds, remember to look at who's making decisions over the dollars and prioritize those. There are opportunities to prioritize those that seed decision making to leaders from and in communities and movements. I think I'll close. I don't know who said this, and I don't know if anyone does anymore, but the definition of insanity is to keep doing the same things and expect different outcomes. The time is now for us to really change how we give, to seed some of the power of our resources and invest in people that can make a real difference. And our kind of core tenet now is give more, give now, give to others of color, and help lay the foundation for a better future. And as Sarah said, join us at Giving Compass to keep learning, become a member, sign up for a newsletter. We'd love to keep sharing resources. I think I agree with all of the recommendations that Sarah made also about Borealis and so many great places to go for help. In addition, locally, there are some incredible philanthropy advisors, Mijo Lee, who was formerly at Social Justice Fund, Stephanie Ellis Smith, my friend and colleague. There's so many people here in our community who are closely connected to communities and can guide giving. So we have a resource directory on Giving Compass as well, where people can look for places to connect and get help. And I will pause and close. Thank you so much. Mark, am I handing it back to you for Q&A?
There. Can you see me now? Start video. Can you see me now?
Yes.
Oh, good. I was off. Can you hear me okay?
Mm-hmm.
Good. Okay. Thank you very much. It was an amazing panel, and we're all thrilled that we have the depth of knowledge in our city to help us through these troubling times. We have two questions, both from Michelle Matthew at Fulcrum Capital. The first is, discuss the opportunities and challenges facing nonprofits that decide to merge or consolidate with other like-minded nonprofits.
I suppose I could start answering that. Yeah, definitely an opportunity for more collaboration and for mergers, and definitely sharing resources where it would not be duplicated with regard to infrastructure. That's certainly the opportunity, and exchanging best practices. So I think there are pluses to that. The minuses would be really how you're able to communicate to the constituent about services that will continue or services that will be adapted in some fashion. But I know that there are organizations that are actually contemplating this, and one organization has already done it. I don't know if it had anything to do with pandemic, but it was like Child Haven recently merged with Renton Family Services and I think Path with Heart. So there may be more that will be happening in the future, and that might actually be good. So all of us really more working collaboratively rather than individually on the same problems.
Excellent. Thank you. Thank you, Lorraine. Anyone else like to chime in on that as far as merging nonprofits?
I'll just add to, I think the question also wanted us to address the challenges. And I think, one of the greatest challenges is knowing when it's actually the right thing to do, and having the capacity to think and plan effectively through such types of strategic alignments in our field. As Lorraine mentioned early on, right now, organizations are strained and stressed beyond their limits. Executing those types of partnerships takes time, and not many people have the bandwidth to think that way right now. At the same time, there are some intermediaries in the field that are supporting organizations. Sea Change Capital Partners, for example, has a whole collaboration of people working together to support organizations that want to pursue those types of partnerships. And it's not always the right thing to do. Sometimes the best thing to have is a small organization deeply embedded in a community that people trust. And that they don't need to get to scale, they need to stay small. And other times, that may not be the right answer. So having the bandwidth to ask the questions, think and reflect and do it well is a big challenge right now.
Well, and that ties into the second question that she had, and that is the implications of getting bigger trends in the nonprofit industry. That's been a trend, and obviously that is probably not happening at this point. Any thoughts on that?
I'll just chime in related to one industry in particular that I have a little more familiarity with, and just in conversations. I think it is a concern, and it is a concern now, especially as sort of the smaller organizations with lower capacity may end up folding, or are certainly stretched and hanging on by a string in some cases. And I had a conversation a couple of weeks ago with Jody Waits at Youth Care, and there is a grave concern. Youth Care serves homeless youth. It is one of the key providers providing shelter and services to homeless young people, and it is a grave concern for nonprofits broadly, and especially in the case of those serving homeless youth. The challenge is that some of the smaller shelters, like the closure at last fall of the PSKS, these shelters are serving and are open and welcoming to youth in a way with a trusting relationship with certain populations of youth, whether that's those who trans or gay or falling into the LGBTQ category, or from certain different cultural or racial backgrounds, and just have the big organizations and the big shelters. There's going to be whole populations who aren't comfortable going there, and so I think that there is a role for smaller organizations that have maybe less capacity but have a particular niche, and there's a fear as those organizations go away of what that does in terms of broadly served populations.
Excellent. Well, that's great perspective on that, and I think the more of that we can focus on, the better in terms of size. Does getting bigger really matter at this stage in the game? So for those
add one more thought, Mark.
Yes.
Sorry,
No.
Not to be redundant, but it also matters. Sometimes it's about the size of the organization. In our field, we talk about, the winners, who gets the most funding, and how many organizations, where the dollars go. And it's not just about the size, but who's leading those organizations and who's on their boards, and therefore how in touch are they, and how connected are they to the communities they're most trying to help. So there are some very big organizations that are very deeply embedded in communities, and then there are some very big organizations that operate at a very high level. And so I think donors also just need to think about and ask themselves, it's not if the big get bigger, but who is getting bigger.
That is
Right. Yeah.
excellent perspective on, especially on the leadership side of that. For those of you that have been to SPAN over the years, you know we always leave with a few takeaways. And today there's more than a few, but I'm gonna limit it to 4 takeaways. The first being nonprofits are building strong foundational fundraising and donor activities directly, less reliance on flashy fundraisers. Number 2, increased interest in planned giving. Number 3, 10.7 billion in response giving so far toward COVID relief. And if you haven't watched Just Mercy on Netflix, do. So with that, thank you all very much for being with us today. Special thanks to Lorraine, Sarah, and Stephanie for an outstanding presentation. And you'll be hearing from us again soon. And thank you for all your support at SPAN. We're adjourned.